Good afternoon, and welcome to Where's the Money? Finding resources to support historically Black colleges and universities and their community engaged work. I'm Al Richmond, Executive Director of Community Campus Partnerships for Health, and I'd like to welcome you to the third of our webinar series, At the Heart of the Matter. This webinar and the others can be found at our website, ccphealth.org. I've been Executive Director of Community Campus Partnerships for Health for the past 8 years. To be clear, we have seen some very lean days financially. There were times when our existence was questionable, due in large part because of the competitive nature of funding and other factors. As a public health practitioner and leader with over 20 years of experience, I can also say that the past 18 months has been the most prolific and robust period of funding for public and private efforts to address health disparities, and related issues. I believe that we have seen a seismic shift in funding from both public and private sources, government, philanthropy, and other sectors. Some segments of even corporate America have stepped up to address COVID-19 and related issues. Out of COVID-19 pandemic, two funding areas have been centered: health inequities and anti-racism work. Arguably, historically Black colleges and universities are well positioned to address both of these issues. The impetus for the At the Heart of the Matter project is a fundamental belief that I hold as a 1981 BSW Bachelor of Social Work graduate of Livingstone College in Salisbury, North Carolina. This historically Black college and university was founded for the education of then colored or Negro people in North Carolina and beyond, primarily associated with the African Methodist Episcopal Zion Church. I believe that HBCUs must assume a leadership role in building trusting relationships in many communities, most directly experiencing health inequities and the adverse impact of structural racism. Consistently, I've heard that resources or the undersharing or under-resourcing by HBCUs has impeded their ability to be more responsive on the front of health equity, hence the purpose of today's webinar. Again, welcome. Next slide. I want to say a little bit about Community Campus Partnerships for Health, who we are and the work that we do. Our mission is to promote health equity and social justice through partnerships between communities and academic institutions. In the past 3 years, I've really worked with our team here at CCPH and our board of directors to really advance our work in working with historically Black colleges and universities, but also historically minority serving institutions at large. These include institutions that have large numbers of students who are African-American, minority, including tribal colleges, universities, and those serving largely Latinx populations. We value health very broadly. We emphasize partnership approaches. We believe in the fundamental need for healthier communities, and we are committed to social justice and strive to model equity and justice in all of our work. Thank you. Next slide. The work of CCPH is often done through 5 strategic pillars, and they are leading, convening, disseminating, partnering, and training. And in any time, these 5 pillars can be working at the same time. Today, through this webinar series, we're demonstrating leadership in working with historically Black colleges and universities. It's certainly a virtual convening. We're disseminating really important information around funding opportunities for HBCUs. We're partnering today with a number of institutions and organizations in this work, and it is about training. Next slide. We encourage you today to actually chat in the chat box your HBCU that you represent. Many of our panelists today, several of our panelists today are HBCU grads. Fatima Garab, who's a team member at Community Campus Partnerships for Health, is chatting that she's a proud alum of North Carolina Central University, class of 2018. And I mentioned Livingstone College. class of, let's see, yeah, some while back. So I'll chat that in a box in a few minutes. At the heart of the matter, which is the project that we're leading today and sharing with you, seeks to engage historically Black colleges and universities, researchers, patients, and advocacy organizations in cardiovascular health. The work focuses on really increasing awareness of who PCORI is and the principles that PCORI supports and advances through patient engagement. This convening series was launched to provide an opportunity for HBCUs to hear more about PCORI, to also develop an action plan to address the health of their campus and their surrounding communities. I want to acknowledge the partners of our organization, of the partners of this project, and they include the American Heart Association, Morehouse School of Medicine, and the Center for Black Health and Equity. So thank you to all of our partners and to all of you who have been working with us for the past year and a half on our project. Next slide. Thank you. The objectives of our program are clear. The At the Heart of the Matter has 4 overarching objectives. First, to increase the knowledge of HBCU researchers and faculties, students and patients and advocacy organizations about PCORI, the Patient-Centered Outcomes Research Institute, to identify priorities in cardiovascular disease. We are thankful that the PCORI team has allowed us to expand our focus beyond just cardiovascular disease. That in the middle of the pandemic, we pivoted just from a focus on cardiovascular disease to also talk some about COVID-19. Our third objective is to establish a network, and we hope that you will be a part of that network. I'm so glad to see all of you chatting in, Sharon Parker and Trevor and others, alums of HBCUs. And so we want to create a network of HBCU faculty, staff, students, and community partners. And then finally, to develop an action plan to engage stakeholders, and you are a stakeholder in addressing cardiovascular disease and related issues. Next slide. So I mentioned earlier about how we've responded, or just globally, what the response has been, even specifically in the US, around COVID-19. I want to take a few minutes to kind of highlight that from my perspective. And what we've seen is an increased level of funding that has come from many different circles, and that includes government, federal, state, county, and city. We're hearing about, even at the county level, county health departments, county commissioners are allocating large sums of money in response to COVID-19. Certainly philanthropy, foundations have stepped up, health foundations and others, to address the range of issues that have been impacting us as a result of COVID-19. Corporate giving has been at an all-time high to address issues around COVID-19, but also being responsive to issues around racism in this country and beyond. And then we've seen private and charitable funding also increased as a result of the pandemic. Next slide. I think that for me, as I kind of thought about what has occurred in the past 18 months since March of last year of 2020, and there have been 2 things that really kind of emerged from me and my thinking, and as I look across the landscape. First of all, there's an increased attention to health equity and racism. And I hope that that doesn't go away, but more people are talking about the issues around health equity or health inequities, as we've seen so prevalent, so pervasive as a result of COVID-19, and certainly racism. But more importantly, the recognition of the intersectionality of these 2. So these 2 issues are not distinct. They are very much connected, and there's an intersectionality there that really has to be looked at. Where we are today in terms of health inequities are in large part or as a result of racism that has been so pervasive, in particular structural racism in the United States. Next slide. So when I think about HBCUs and where they sit, so as we began to think about, kind of the conceiving of this idea and talking to our partners and talking to others and even my own experiences, having attended an historically Black college and university, it made me think about like where these institutions sit. And that's really important because most of them, without exception, are in close proximity to the issues that we're talking about. Historically Black colleges and universities sit squarely in historically African-American communities. They serve as anchor institutions in these communities. And growing up in Charlotte, North Carolina, I lived within a few blocks of Johnson C. Smith University, an historically Black college there in Charlotte. And I remember running up to campus as a child, my twin sister and I, when we, in the fall of the year, about now, when we could hear the marching band on the field, and we would, the campus of Johnson C. Smith is so beautiful. And we would just run around the campus and think and dream about the day and when we would attend college, because we were in such close proximity to Johnson C. Smith. So these schools, all of them without exception, are in close proximity to the issues that we talk about regarding health inequities. They're also in proximity to the very communities that have been disproportionately impacted by COVID-19 and other health inequities. But they also have a trust factor. Historically Black colleges and universities have shown throughout the years to be very much trustworthy agents and anchor institutions within their institutions. So at a time when we really are struggling with trust in this nation, HBCUs have established that trust. They can be trusted. And that's why we felt that this was the moment and the time when we really needed to center the work of HBCUs and highlight their role in making a difference in addressing structural inequalities, structural racism, and structural health inequities. And finally, they have HBCUs, that is, they have the expertise and the lived experience of administration, faculty, staff, and students. Many of the staff, administrators, and certainly the students have lived in historically minority communities. They have close ties and connections to these communities through a range of organizations, through alumni associations, through Greek letter organizations and professional organizations. So they have both the expertise, the scholarship that's needed, and the lived experience to allow them to be leaders in this space of equity and justice. Next slide. So we believe that HBCUs really can advance the work and that it's important to fund this work, to learn about the priorities and the program areas that are important to HBCUs and their communities, to establish relationships with program officers. This is really important for those of you who are representing HBCUs to think about this, to learn about funding opportunities, to establish relationships with program officers, to find about the research and the public policy issues that they're working on. So we're going to talk this afternoon about what you can do to secure funding. And these are things that we're offering to you as suggestions, and certainly to become a champion of the work that you're doing and a subject matter expert. And then finally, to establish relationships and partnerships with journalists to raise the visibility of your institution. We should never be forgotten. The work of HBCUs must never be forgotten in our communities. And certainly the fact that they are centered or located primarily in the southeastern region of the US, where we're seeing really high rates of COVID-19, but also conversely, lower rates of vaccine uptake. Next slide. So in the past 18 months, we've been hearing a lot about funding for HBCUs, and we wanted to just highlight some examples of that funding. $1.7 million in emergency grants have been awarded to 16 HBCUs by the Andrew Mellon Foundation in May of last year. The Gates Foundation has also offered support at $15 million to 10 historically Black colleges and universities. The Corporation for Public Broadcasting and many others have stepped forward in this space to fund HBCUs and their work in their communities. Next slide. This slide just highlights examples of the top government and nonprofit supporters of HBCUs. These include a range of federal agencies and entities, but also 10 of industry supporters, everything from Lockheed Martin to General Motors. All of these groups have stepped forward in this moment to acknowledge the important role that HBCUs have in supporting and advancing equity in their communities. Next slide. We have this quote by Harry Williams, who is the president and CEO of the Thurgood Marshall College Fund. I think this is very poignant. He says that Thurgood Marshall is confident that the public interest in Black colleges is sustainable. Calls for racial justice following nationwide protests delivered record donations and other outpourings of support. But even as public attention may have waned, the interest among philanthropists, corporations, and policymakers remains. So it's important right now that we seize this moment and advance the work of HBCUs. In closing, he says that this is not a fad. We are now at a place where it is structural, and it's you that will help us to advance this work. Next slide. So I want to talk some about PCORI. I've mentioned PCORI, the Patient-Centered Outcomes Research Institute. Our team is going to connect you to PCORI through the chat box. It's pcori.org. I want to share about PCORI because we have, I've personally have really admired the work of PCORI. This project, the At the Heart of the Matter, is funded by the Patient-Centered Outcomes Research Institute. We want to use this kind of as a case study or case example of how you can connect to work that will really support what you're doing in your communities. So I'm going to talk some about PCORI, how we became involved and connected to PCORI over the past, I guess now 6 years. Next slide. So PCORI was founded in 2010 by Congress. It's governed by a 21-member board of governors representing the entire healthcare community. They fund comparative clinical effectiveness research, or CER, that engages patients and other stakeholders throughout the research process. They seek to answer real-world questions about what works best for patients based on their circumstances and concerns. Next slide. Why the work is needed and why it's important. For all the advances that it produces, traditional healthcare research has not answered many questions that patients face, including very basic and fundamental questions around quality of life issues. People want to know which preventive, diagnostic, or treatment option is best for them. What works, A or B? I think about even in a moment of COVID-19, people were asking, which vaccine is the most efficacious? So even at that level, and then patients and clinicians need information they can understand and use. Next slide. The mission and strategic goals of PCORI are very clear. Research is guided by patients, caregivers, and the broader healthcare community. It's designed to increase quantity, quality, and timeliness of useful, trustworthy research information available to support health decisions, to speed the implementation and use of patient-centered outcomes research evidence, and to influence research funded by others to be more patient-centered. And that includes all patients. So when they talk about stakeholders, we're all stakeholders, we're all patients, but stakeholders include clinicians, patients, consumers, hospitals, payers, purchasers, training institutions, HBCUs. You are a stakeholder, and we want to make that very clear. Next slide. So PCORI has what I call, kind of in layman's terms, two sides of their organization. There's the research side and there is the engagement side. And so I want to take a moment to really share with you about some funding opportunities that are available on the engagement side. So they have three funding mechanisms that I want to bring to your attention that we've been able to take advantage of as an organization. They have capacity building awards. This is through the Eugene Washington Engagement Award mechanism. The capacity building awards are for up to 2 years and are at $250,000. We've received two of the capacity building awards. There's the dissemination initiative, which is up to 2 years, and they are $250,000. And then there's the stakeholder convening support, which is 1 year up to $100,000. And this particular project, the At the Heart of the Matter, is supported through a stakeholder convening support mechanism. It's very simple. Our proposal to PCORI said that we would convene researchers, faculty, staff, students, and community partners of historically Black colleges and universities in the southeastern region of the US to develop an action plan that would prioritize health issues in the area of cardiovascular disease and COVID-19. Our goal initially was to have an in-person convening that would take place on the campus of Morehouse School of Medicine in 2020. As a result of the pandemic, we were not able to have an in-person convening. So the PCORI organization allowed us to pivot towards a virtual convening. And so what we've done is kind of offered our convening in a series of webinars over the past 2 weeks and about 3 to 4 weeks into the future. So what I found in PCORI is a willingness to work with organizations to be responsive to their needs. And we've just found that the partnership with them has been really so meaningful and so impactful for our organization. It's been really a transformative influence for our organization. In particular, about 6 years ago, when we received our first capacity building award for $250,000. I think as a leader, it was my first big award, and I was so excited to share the news with my board and our team at CCPH. Next slide. So I mentioned, as I mentioned, we received three engagement awards. The first award was made in 2016 from PCORI. The title of that award was Facilitating Patient Stakeholder Engagement Through Partnerships. You can go to PCORI.org, PCORI.org, and find out more about each of these. So there's a website. Their website allows you just to put in our name, Community Campus Partnerships for Health, or my name, Alan Richmond, and it'll bring up all of our awards and it'll describe the awards. So in 2016, we had an award. In 2017, we were awarded a second engagement award, and that award was entitled Patient Engagement, Enhancing Culturally Appropriate Research. And our current award is At the Heart of the Matter, Building a Framework for Collective Action. So I wanted to share with you that we've done this work and you can do it as well. Next slide. So why PCORI Engagement Awards? You know, you say, well, why are you so excited about this? What's so special about them? And I wanted to highlight, you know, some things from my perspective. And this is just from my vantage point, right? So first of all, the engagement awards are not research focused. They are just that. They are engagement awards. What I found is that HBCUs, what we do best at HBCUs is engagement. We certainly have the capacity to do research, but many of our smaller HBCUs, they're not necessarily involved in like what we'd say research around discovery, but what they do really well is engagement. This is not to be disparaging of HBCUs, it's to recognize that they're on a continuum of their capacity to be involved in research. The first step, maybe even into research, would be around engagement. The second area that I really like about PCORI and the Engagement Awards is that the application process is straightforward. It's very straightforward. Again, when you visit their website, they have many templates around writing the proposal, developing the budget. There are so many resources, including their staff, that are readily available to help and assist you when you are writing and designing. Even the idea of an engagement award, you can talk that over with them. That's what I did. I met with the PCORI staff and I talked to them about the idea that we had around engaging HBCUs, and they gave us lots of ideas and feedback and helped us to kind of think that through. The third thing is that the engagement awards allow for flexibility and innovation. They allow you to think about how do you engage people in innovative spaces and through novel approaches. They're disease agnostic, which is important. They don't focus on a specific disease. So your area of interest or your passion may be around cardiovascular disease, women's health, it may be around cancer, it may be around pediatric health. And so this allows you to think about bringing together stakeholders in an engagement award around a number of topics, any topic that's of interest to you. And the fifth thing is that what's so important about these engagement awards is that it allows you to connect with the community, the very communities where you're situated in. It allows you to connect with those communities and other stakeholders and to bring them in and bring them together. And they support this for up to $100,000. And that's really great. Next slide. So again, why the PCORI Engagement Awards? So the submission dates are on a rotating basis. So oftentimes one of the things that kind of stands in the way is that you have busy schedules as academics, as researchers, as faculty, community partners, and so you miss a date. Well, the good thing about PCORI is they typically have for their engagement awards about 3 times a year that you can actually apply for an engagement award. So if you can't do it now, continue to work on your idea, connecting with your community partners, your patient partners, and apply at this next cycle. The second thing, and I mentioned this earlier, is that PCORI staff will work with you from ideation to implementation, even to dissemination. And so they're very open and very receptive, and they want to hear your ideas. They want to hear from you. And the last thing is that the requirements they require that you submit a letter of interest. And what I like about the letter of interest is that it is a step that you'll have to take before a full proposal. But what this allows you to do is to submit the idea so that you're not overwhelmed with writing a full proposal at the outset. The reviewers will even provide you with feedback on your LOI if it's accepted, and then we'll say to you, in order to be fully where we would want you to be, right? To meet our guidelines, you would need to meet this following criteria. So repeatedly, when we've applied through an LOI, they give us feedback and tell us the improvements that they would suggest that we would make in order for our proposal to be really of merit to PCORI. And that's really good. All organizations and groups and foundations don't do that. And so I think that's really important. Next slide. So I want to open up now to some questions from you. Chatting your questions, or you can unmute your phone. Would like to hear from you if you have some specific questions about PCORI or others about funding at this time. Okay, we'll move forward with our webinar series. I want to turn our reins over to Marilyn Grier-Union, who works with us, who is the director of the RADx-UP community engagement work that we're doing with the Rapid Accelerating Diagnostics for Underserved Populations. And she will share more about the work that we're doing on that front with our Coordinating Data Collection Center. But before we do that, just have one question. Sharon Parker says, what is the turnaround time for applications? It's typically within 45 days, which is really fast. And so that gives you an opportunity to know fairly quickly if the project is going to be funded or not. So LaShawn Hoffman says, can a community partner or CBO be the lead applicant in partnership with an HBCU? Yes. So we are not an HBCU. The work we're proposing to do, that we're doing, is in partnership with HBCUs, multiple institutions. And so you don't have to be with an HBCU. You don't have to be limited by where you kind of sit. You can be in an academic setting, or you could be in a community-based setting as well. Please continue to chat in any questions, and we will return to the Q&A. And I'll turn it over now to Maryland.
All right. Good afternoon, everyone, and welcome. Thank you, Al, for the introduction. I'm delighted to be here today to share information about these grant opportunities that's offered by NIH through the Coordinating Data and Collection Center. But before I get started, I'd like to tell you a little bit about how CCPH got involved in COVID-19 work. Back in 2019, Al and Paige were working on other issues around community engagement with PCORI and lots of other partners. And so, because CCPH was well positioned and had made many relationships and had lots of connections, had a lot of credibility in the work that they're doing, they were positioned well to partner with Duke and UNCC. And so we're just really pleased to be able to do this work. And as a result of starting this work and pivoting last year to respond to the pandemic, we are now working on more than one COVID project. So I just wanted to say, follow up on what Al said in terms of building those relationships and connections and creating to help to position yourself to be able to take advantage of large opportunities like this. And so today I'm going to be focusing on NIH grant opportunities that are funded through a center. And so this project is part of a national NIH effort, RADx-UP, and that is Rapid Acceleration of Diagnostics in Underserved Populations. There are a number of other RADx projects in this NIH initiative, but the one that we're funded to do is associated with working in populations that are most impacted by COVID. And so, as I said, this is a national effort. I'll be sharing two grant opportunities with you. One is the rapid pilot grant opportunity. The other is a community mini grant opportunity. And so, just a little bit about the grant itself, this overall initiative. So it's part of the NIH's $1.4 billion initiative to help speed innovation and the development and implementation of COVID-19 testing. And there are three other programs that I mentioned earlier, but the one we're focusing on today has to do with underrepresented communities, that is their language. And we received an $80 million grant in partnership with Duke and UNCC over a 4-year period. So what is RADx-UP? So RADx-UP is researching COVID-19 testing patterns in communities across the country and data on disparities in infection rates, disease progression, and outcomes. RADx-UP is also developing strategies to reduce disparities in COVID-19 testing by supporting projects across the country, as those that you see on the slide here, with established community partnerships, and that is key. You need to, one of the criteria is to work in partnership with community organizations for many of these grant opportunities. And again, the ultimate goal is to reduce health disparities, and we are doing that through testing. Next slide, please. So these are the two grant opportunities that I'll be talking about today. As I mentioned, I will spend more time talking about the community collaboration mini grant opportunity. The Rapid Research Pilot Program is another one that is geared towards larger institutions. And I won't read all of this. We're going to refer you to the website so that you can learn a little bit more about this. But what I'd like to say about CCPH's role relative to this program is that we provide community-centered, flexible program infrastructure and a participatory and inclusive community engagement program by providing services to these mini grant and pilot program grantees around the country. We also provide capacity building, training, and technical assistance. We support and helping to build a robust knowledge repository. And we provide also content expertise in the design and implementation of convenings and materials, making sure that they are relevant and accessible to our community partners. So, as I mentioned, this is a partnership with Duke University as the lead in this effort and the University of North Carolina. And these two large institutions support specifically, these are specifically for, as I mentioned, community servant organizations, the mini grant for community servant organizations that include health centers, faith-based organizations, and other smaller community-based organization. This other one, the Rapid Research Pilot Program, it's a competitive grant offering by NIH, as I mentioned, but through the Coordination Data and Collection Center that supports all of these grantees around the country. And both of these are currently accepting grant applications. This grant will serve overall, as I mentioned before, to improve the access and uptake of COVID testing in our communities that are most impacted. That is ultimately what we're trying to do, is to increase the access and uptake of testing in these communities. The research pilot, just briefly, covers direct costs to help researchers at HBCUs and tribal controlled universities and colleges get COVID testing to their communities and help build the science around ending health disparities. And again, please share these opportunities with people in your network as well. Next slide, please. So to focus on the community mini grant, basically it seeks to build the capacity, seeks to increase the capacity of COVID testing expertise within communities. So for example, if it's a faith-based community, they might be able to get funding to provide training to their community partners, or may be able to provide direct services to some of the people in their community are focused on testing. And other examples include education, communication, information dissemination. Some of the grants are supporting messaging in communities or national or local campaigns to dispel some of the myths that have been promoted around testing and COVID and vaccination. It also will fund capacity building related to testing and contact tracing. It'll fund isolation, among others in communities that will increase our ability. This program is to help increase our ability to decrease collaboration. To decrease COVID-19 transmission and save lives in our communities. Next slide, please. All right, and just to back up a little bit, I mentioned the Coordination Data and Collection Center. That is a center that has several, that supports several efforts related to these projects. One, it supports testing strategies. It supports outreach and data collection and community engagement, helping to build community engagement efforts for especially the grantees who are partnering with communities, but are finding barriers to reaching communities. So we're helping to train not only the community-based organizations, but also some of the academic institutions who have received these grants. And CCPH's role is, Al is the co-lead in the community engagement core. And again, we're supporting 80 of those organizations. This next slide, it just kind of highlights some of the elements that will go into the application. The one I just want to highlight is the approach, and that should be no more than 5 pages, I believe. But again, you can get more specific information on the website. Next slide, please. And this next slide just shows the importance of really creating a timeline so that you are prepared to and have time to communicate with the program officers or the staff at the CDCC who can answer any questions related to the budget justification. They can also, let you know whether or not your idea is one that is feasible or that fits into the goals of this particular initiative. And so it's just important to create a timeline so that you have the central office will really have time to review that. As you know, if you're late, you definitely will not have any opportunities in this particular setting. In some of the ones that Al mentioned earlier, like in private funding, if you have a relationship, you might be able to speak with someone and get something in a little bit later, but not in this case. Next slide, please. And I just want to highlight these are just some of the barriers and some of the problems that we have observed during the process of reviewing applications from some of the community mini grants. One is clearly just, it's important to communicate with the officers to ensure that your proposal is aligned with what we're trying to accomplish. Also, there have been misunderstandings about roles and responsibilities and timelines. I'm sure that many of you have already experienced this, some of you have experienced this in creating proposals. And again, just making sure that you submit your proposals and that you have completed it and that it's compliant, and also that all the information is accurate. I've seen many proposals taken back that, all right, looks like my time is up. All right, thank you. And we'll be able to answer questions at the end. Thank you. I'm gonna turn it over to Aaron Shirley, whom Al is gonna officially introduce.
Yeah, sure. Thank you, Marilyn, for sharing with us about that particular funding opportunity. Our intent of this webinar series today has been to just really highlight opportunities through PCORI, through RADx-UP. I want to introduce Erin Shirley Ori, who is a public health advocate. She and her siblings actually lead the Erin and Ollie Shirley Foundation. And we have the website here, the shirleyfoundation.org. I met Erin about 4 years ago in Jackson, Mississippi, where she lives, and want to acknowledge that she's a current PhD student in public health at Jackson State University. And she is also a RADx-UP Community Mini Grant Project recipient. And Erin, we'd like to hear from you, from your perspective about the funding opportunity that Marilyn described and the work that you're doing in the Delta to address issues around COVID-19.
Well, thank you for that warm introduction. Yes, we are a RADx-UP grant, mini grant recipient. It's a great opportunity to get funds to be very creative in getting access to COVID-19 testing in underserved areas. So our focus is in the Mississippi Delta. If you're familiar with that area, it is rural and predominantly African-American. And the two counties that we are targeting are Holmes and Humphreys counties. Those counties are at least 75% African-American population, where the median household income is $28,000. They also were counties that had very high incidence rates of COVID-19 during the height of the pandemic. And so we target those areas to help get them access to COVID-19 testing. So what we have done, we've partnered with a couple of federally qualified health centers that services those areas. One in particular has a mobile unit that goes out and provide COVID-19 testing. And we are doing the community outreach, utilizing community health workers to get the message out. So whenever there is a mobile unit in their communities that we're targeting, we're helping them understand where they can go, when they're going to be there, help them get scheduled if they have to do that. Most of them, you just have to show up to get tested. And so this has been a great opportunity to get out into the community and making sure that those who ordinarily would not get access to COVID testing, that they do. We have quite a few that require a negative test to either like get back to work or things of that nature, but don't know exactly where to go to get tested, because again, these are in rural communities. And so this has been a great opportunity, a financial opportunity to get us in those areas that typically do not get served.
Thank you, Aaron. And we'll hear more from Aaron as part of our Q&A as well. And we hope that you will consider applying for one of the RADx-UP community mini grants. This is a really wonderful opportunity for you to take advantage of resources that, again, we're kind of saying it's money leaving on the table, right? So we don't want you to leave this money and these resources on the table. We want you to really think about how you can apply for these funds to support the work that you're already doing. And that's something that we recognize, is that this is not new work for you. It's really supporting the work that you're already doing. Thank you, Aaron. Nicole Augustine is the founder and CEO of RIZE Consultants, a strategic consulting firm founded in January 2015. RIZE provides advisory services that increase performance, prioritize diversity, cultivates the development of equitable and inclusive work environments. RIZE is anchored in a core value: diversity breeds innovation. My work with Nicole has been primarily around her leadership position for the North Carolina HBCU MSI addictions program. I thought that we wanted to have her as part of the conversation today because of a recent grant opportunity that she was afforded. And so my discussions with Nicole, I was like, wow, you've done so much in a short period of time with historically Black colleges and universities in North Carolina. I want you to come and be a part of the webinar and share that with others throughout the region. Nicole, we're glad to have you. Please take it away.
Yes, thank you so very much, Al. It's a pleasure to be here today. Okay, great. I'm just going to do a quick screen share. I made a few slides just to kind of share with you guys a little bit more about myself, and then again, as Al was saying, how we came to know each other. So give me 1 second. I'm clicking on the wrong button over here. Here we go. Sorry, there we go. Couldn't see my menu. Okay, great. So I believe you guys are seeing a picture of me, right? Which screen is showing up here? So what I wanted to share with you guys is a little bit about the HBCU MSI Collaborative Network and how this kind of came about. In October of 2020, I actually joined Addiction Professionals of North Carolina as their prevention director. And in that role, I was tasked with providing leadership for the HBCU Collaborative, which had just gotten started. I believe, Al, you were a part of it before I got there, and it just begun to come into existence. And so the state of North Carolina had received a Partnership for Success grant. And as a part of this project, they were wanting to focus on health disparities, specifically in communities of color. And so this collaborative network kind of loosely got started out of that, and as a result of that. And so since October to June, we found out in June that there was an opportunity. As many folks have been saying, COVID-19 has created an environment where a lot of money, a lot of funding is coming for multiple reasons. One, to address the pandemic, but two, the fact that the pandemic has really shined a light on some of the inequities and disparities that are occurring in our country. And so we found out about a grant opportunity. And at the same time, I was making the decision to leave and focus on my business. And so because of the networks and collaborations that were made within the network, what was really awesome is we had the opportunity in a very short amount of time, I think it was like 4 weeks, to apply for supplemental funding that was coming to our state. And the total award ended up being $184,500 for 20 months of time. And essentially, we created a project that we're calling Collegiate Resilience Healing Post-COVID-19. And in this, we were asked to, the purpose of this funding was to provide innovative strategies to speak around resilience. And so the HBCU network pulled together our folks, and we had a brainstorming meeting and had conversations about how we could think about ACEs and resilience and the social determinants of health to create an innovative program that would happen in just a 20-month portion of time and get funded. And I think what was really profound about this experience is this group had just gotten started as a group. Like I said, I joined and became a part of leadership in October. And so for just the last couple months, it's just been an amazing whirlwind. I will share with you the project that we submitted. It has three main components. The first one is the academic study component, and that's the part that I, as the owner of RIZE, is responsible for. But essentially, what I decided to do is to create an internship program and to leverage the federal work study program. So most of you, who are familiar with colleges know that students have an opportunity to be a part of federal work study. What's really, really great about federal work study, I found out, is that the federal government pays for 75% of the salary, and then that the school or department is responsible for 25%. So when I built the budget for this project, I said, well, why not help the schools out? And the grant will cover the 25% portion of the student's salary. So this internship program, students will be hired. It's 4 schools that are involved, and I'll let you know which schools are involved. But each school will have 5 students. The students have been budgeted for 10 hours apiece. 5 of the hours will be with myself and my team on RIZE. And that learning period will be split between talking about what is prevention science. I've got a team I'm calling my resilience team, but thinking about how to really improve resilience and be trauma informed. And then the other big piece I'm excited about is giving these students skills around policy and advocacy change. And that's the first component that they'll do throughout the 20 months. The other part of their time will be actually just used as internship hours directly to the schools that they're supporting, to their counseling centers, to their health centers, which is awesome. Each school will now have 25 hours a week of time from students to assist in whatever type of operations they will need to. And then of course, as they have interest in behavioral health services and those sorts of things, they'll get that direct experience from the centers that they're working with. And then the last component of the overall project is this culminating experience. So the idea behind this project is that between the learning that they receive from my side and the learning they receive from their schools, that the students will identify a substance issue, a substance prevention issue that they want to work on their campus, whether it's underage drinking or vaping or marijuana, whatever it may be, all the different types of vices that people lean on when they're stressed. Because the main thing that we saw as a result of the pandemic is extreme rates of increase around substance use. And so the idea is that these students in partnership would identify an issue on their campus, and then through the skills that they've learned, they would develop some sort of campus-wide project that would then address that issue, whether it's a project that's focused on policy changes or whatever. I decided to keep it very, very open so that the students could really develop and cultivate that experience. And so this was the idea that we presented to the state office in our grant proposal, and they liked it. So in a short amount of time, we went from a group that was just hosting meetings to talk and network to sitting and organizing our thoughts and submitting an application, and now being in a position, we just found out a few weeks ago that we did get the grant, to starting this process. We have 4 schools that are participating, NC-A&T, Bennett College, Winston-Salem State, and Fayetteville State University. So we're super, super excited about this. And we're already, I know me, I'm already looking at how else we can start to gather more funds for this project and the expansion of it, because we're really excited about, one, what the students end up coming up with. I know for me, I'm very much so thinking about our next generation of leaders, and investing in our colleges and our universities and students is so paramount to that. And I really loved what Al said at the beginning, that if you think about it, our universities are uniquely positioned to do amazing work in the communities that they live and reside in. And so my idea with all of this is that if we can get a group of students who are in a sense ambassadors, community ambassadors, if you will, and are able to have the skill set around communication, around leadership, around understanding prevention. I think, I forgot who mentioned it, that community health worker model. That's the same concept that I'm having here, is if we can get a cohort of students that are on all of our campuses to be doing this work internally, but also affecting the communities that these campuses sit in. I think it's an awesome, awesome opportunity. And so I appreciated being able to share kind of my whirlwind experience of coming into funding. And really, this was a thing of opportunity. With so much happening right now, honestly, as far as funding is concerned, it's a great space to be in when you have the right idea and there's alignment to where there's so many wonderful things that can happen. Even in this few minutes that we've been talking, I've been jotting notes of, you know, potential funding that even the HBCU network could be looking at for the future. So I'll stop sharing here, but hopefully I didn't talk too fast. I wanted to make sure I give time to other people.
No, absolutely. Thank you so much, Nicole, for that presentation. And we want to engage in a period of Q&A because this is really all about you. This was designed in some ways to be an informal conversation. We shared a lot of information, but we want to hear back from you. And I want to just start with Nicole. We have a couple of questions, and one of those questions is, what are the next steps for the North Carolina HBCU network? Like, what are you thinking in terms of where this might go?
Yeah, so honestly, the first next step for me is really building the structure and the business side of the group. Essentially, the group is a coalition, if folks have heard of the coalition term. But, you know, we are a network that represents multiple schools that have come together really to talk about substance use issues. That's really what brought the group together, is looking at how substances are affecting campus culture. With that, COVID-19 came on, and so it just exacerbated a lot of things. So for me, we're at the place that we're a group that got started underneath a grant. And so we're kind of at the place of really getting our own feet, getting our own standing, which has been awesome. And getting this first set of funding has just really helped. So our first next steps are, one, we're getting a website. We've got folks internally who are working on helping us get a website built, getting social media together, strengthening our partnerships and collaborations, and truly seeking additional funding, you know, is where we're at right now, so that the vision of the group can grow.
Yeah. You mentioned, as you've been a part of the conversation today, that I'm getting to know you more, but some of the ideas that have been percolating, what have you been thinking about just as a result of being a part of the webinar? Because I certainly can think about some opportunities, because PCORI actually does fund some issues around behavioral health. What are you thinking? What did you hear that's kind of piquing your curiosity?
Yeah, of course you would ask me this, Al.
Yeah.
But yeah, no, you're right. So actually, I was very much so interested about PCORI, and I was like, oh, I wonder what type of initiatives they support. I was like, is there a space for the substance prevention, you know, folks in that? So I was definitely thinking about looking into that, the community mini grants. I do have a very strong interest around COVID-19 testing, vaccination uptake. There are like so many conflating things, you know. But I would say I'm thinking about expanding the collegiate leadership component. Right now, the current project we have will allow us to fund 20 students, which would be 5 students at each school, which is a wonderful start. But it's just a start. So I'm already thinking about, how do we access and get these students to do more? I think of the students as a cohort of ambassadors, wellness ambassadors, right? So if you think about it, if you arm them with the right kind of skills related to public health and communication and leadership, they can use that to speak to anything, whether it's, you know, encouraging people to test, encouraging people to be well, be safe, all the myriad things that are happening in that college space. So my brain has been buzzing. I clicked on every link. I got my other page out in the back. I'm gonna save all of those and dig in a little bit more.
So Nicole, the other question I would have of you is what you highlight, and maybe just as an observation, not necessarily a question, and that is that the funding that you have received actually allows you to engage in two things. Number one, job creation for students, right?
Yes.
And pipeline development in the area of addiction.
Mm-hmm.
And I think both of those are important.
Mm-hmm.
And so this is one of the things that I think that we want our participants in the webinar and those who will listen to it and be when it's archived to just think about, like, funding is not just about doing research. It's also about, it can be about job creation. It can be about pipeline, creating that pipeline. Say more about how that was important to you as an addiction professional.
Yeah, so I'm actually glad you asked this because it's important in more than one way. I am a nerd, a brainiac, a researcher myself. I've studied population health and I've looked at the ways in which substances wreak havoc on our communities. And then there's a complete disconnect between folks of color being on the treatment, prevention, recovery, harm reduction side professionally. And so for me, when I'm getting to an age right now where I'm in this place of life where I'm thinking about the future, I'm thinking about who's replacing me, I'm thinking about my mentors retiring and aging out now, right? And so I'm in this space of really being conscious of what am I doing to bring up the next generation? And so when I got the opportunity to think about this innovative strategy, it was also important to me to make sure that if I'm going to create a program for students, that I compensate them in some way. It's been really, really powerful. The first time I got a chance to kind of test this out was when I was employed at APNC, and I helped to create an 8-week program for students. And I advocated to give every student a stipend of $1,500 for that 8 weeks. Because I wanted to make sure that the students were going to be there. I remember being a college student and needing money. And if I'm going to ask students to invest time and do a project and really be a part of community change, I can't expect them to do that for free because I'm not doing it for free, you know? And so what has been really powerful is shifting how I think about the program budget and taking the majority of the budget to pay the students first is how I do it. Because for me, I feel like if I can make sure the students are paid, they will choose this internship over having to skip my class, for instance, to go to work. You know? And for me, I'm like, the work of prevention, the work of community change requires time, energy, and dedication. And so often in our 501c3 nonprofit world, we expect people to give that work for free. And then to me, I'm like, then we wonder why there's struggles to keep people at the table. So for me, it was twofold, you know, the focusing on how I can make sure, and then I realized I'm getting excited. But what I realized is once I did some research, I was so happy. My contact at Fayetteville State, she's the one who found out for me about the 75-25. So we were like, well, if the average student's getting $10 an hour to work on campus, and all I have to pay is $250, I can have a student, it's like $1,200 a year to hire a student. Like it's such a reasonable ask, you know? So the numbers became easy to me. And now I'm all excited about that. And it gets more folks of color into the space of these conversations. Because I know me, I accidentally fell into this work. I didn't know anybody who was doing prevention or addiction or treatment stuff. But I had plenty of family members who were struggling, you know? So I see this as an opportunity to introduce students to this concept of prevention, mental health, behavioral health, get their feet wet through an internship experience, and also have them contributing to some good on their campuses and hopefully the surrounding communities.
Thank you, Nicole. Aaron, you know a lot about challenges of foundations as part of your own family foundation, but also you know about the challenges of HBCUs, really kind of growing up at Jackson State in many ways and being a student there. How has this opportunity in terms of funding afforded you the resources to kind of grow the work that you all are already doing? And certainly talk a little bit more about how you've engaged Jackson State. We'd love to hear that.
Well, first of all, since I'm a student at Jackson State in the School of Public Health, working on my doctorate in public health, that's one thing. The bigger picture of this is the School of Public Health is actually named after my father. So it's the Dr. Aaron Shirley College of Health Sciences. And it is housed in the Jackson Medical Mall, which is what he founded, which was a former shopping mall that was abandoned, and he had a vision to create it as a one-stop shop location for the community to be able to get access to healthcare. And so that alone, with that partnership or collaboration with Jackson State, is huge for us. And so we do a lot of work with Jackson State and with the Jackson Medical Mall. It's so easy for us because it's all in one place. And so, but to answer your question about this opportunity, just being able to have some additional resources to get people out into the community and engage with people in the community, it helps out a lot, because just a mere help paying someone's or reimbursing someone for their, say, mileage, so to speak, from going from one place to another in our different in the communities that we're serving, that helps out a lot, because with community health workers, a lot of times they are so willing to travel to different places, but may not have the means to do so, or, you know, for especially with gas prices going up and things of that nature. So that alone, with being able to just pay someone to help us do outreach and going out into communities where they are from and that everyone knows them and kind of trust them, helps out a lot. So with, and so what we do also is share these experiences that with students at Jackson State, so they know what's going on as well in trying to get them engaged in public health. They kind of see it firsthand, as opposed to reading about it in a textbook. Now they can see firsthand how things are happening on the grounds in our communities as it pertains to public health.
I appreciate you bringing up Aaron bringing up the Jackson Medical Mall, because it's a must see. Like, you have to put that on your list of things to see. It's so inspiring that the moment that I walked in there and just thought about the fact that that was really one man's dream and vision to transform what was otherwise just an urban blight, right, in Jackson, and to transform a mall into where the School of Public Health is located, where the county health department has offices, where the cancer center is located. A myriad of resources are available at the Jackson Medical Mall. And so this conversation really also makes me think, Aaron, is like, oftentimes we shy away from this conversation around funding as if somehow or another it's a bad thing, like we shouldn't be talking about money. But it's so important, because we need money to actually make the vision a reality. How much, I'm putting on the spot here, how can you recall how much it was to just to transform that mall right now? How, like, when your father and the team purchased that?
So I don't know how much it was total to transform that mall, but I do remember one of the things that banks were hesitant to provide funding. They were very hesitant to provide a loan, right? And so my father, again, came up with this concept of like, okay, if I can lease out all of these, basically lease out all of these spaces, if I can get tenants to fill up this space, I can prove to you that we'll be able to pay the loan, because this is their rent. And that's what he did. He was able to get commitments and leases for office space and in the mall before he was even, you know, remodeled, so to speak. And so he kept that. He did get they got a check for $1 million just to get started from one of the banks. And so that was like the main thing that he kept in his office framed to show, that initially they didn't want to, they didn't believe in it. They couldn't see the vision. They just couldn't see it. But after he's able to produce all of these tenants that saying, hey, we want to be there, let's sign the lease. This is what my rent is going to be. They saw for sure that, it was a viable opportunity.
And I think that's a great example to HBCUs that have space, that are thinking about expanding their campus or unused space on campus, right? Like transforming that for use by the community. And so when you walk into the mall, it's huge, and you see this huge sign memorializing Dr. Shirley, and to have the School of Public Health named after him. I mean, really a leader in health equity within the Delta is just, it's just kind of, it just kind of humbles you. And so I'm so glad that you're here to share about your father, but also the intersectionality between Jackson State University and the work that's being done at the Medical Mall. Marilyn, I'm going to call on you now. You talked about the mini grants, the community mini grants. I want you to clarify for us, how much are these mini grants?
Okay, so the mini grants, the grant covers up to $50,000 in expenditures over a 12-month period. And so I believe right now we have funded up to 12 of the mini grants since we've been in existence. And I believe I didn't mention that for the Rapid Research Pilot Program as well. That covers up to $200,000 in direct cost for a 12-month period as well.
Nicole is asking, is a 501c3 status required to apply? Yes, it is. And again, you would need that and to be able to apply. But it would not preclude some of the HBCUs from applying as well. And so there's a link. Emily has placed a link in the chat box to find out more about the grant opportunities.
And Al, I just want to add, she could identify a sponsor, a partner with the 501(c)(3) status. That would be one way to apply for a grant as well.
Yeah.
Perfect. Thank you.
As we close out today, what I'd like to do in kind of round robin style is to give each of you an opportunity to really kind of, share with us anything that maybe you forgot to share earlier in the conversation. And so I'd like to just start, Aaron, Marilyn, Nicole, in that order. Anything that you would kind of like to leave with our participants about funding, about where to look for funding? What do you say, Aaron?
Well, I would just say definitely take advantage of this, the RADx-UP grant, because again, I think that's a very good funding opportunity to get anything started related to COVID-19 testing. Mm-hmm. Especially, and then because I think about HBCUs and the communities and how you can collaborate with larger institutions. So for example, like Marilyn mentioned, it's $50,000, but it can go a long way when you collaborate with the larger institutions or other community-based organizations, which is what we've done. So we've been able to collaborate with agencies that's already doing a lot of the work anyway. We're just kind of enhancing it by community outreach. So I think that everyone should look at the RADx as a great opportunity to get started in something like that.
Aaron, that's a great point that you made, because this money can seed other work, but it also can serve almost matching dollars, right? Absolutely. So if you could get $50K through this mechanism, or say through PCORI, then who locally would actually match those dollars? Mm-hmm. Marilyn, you got excited about that.
I did. I absolutely did, because of the fact that we have had, I believe, 2 rounds of the community mini grant opportunity. And so we've only funded 12 to this point. So what that says is that we really got to get the message out there that these opportunities are available, and not just within RADx-UP, but also, in some of the private foundations and corporate foundations, because often they are seeking opportunities to support especially community-based organizations that have individuals with lived experiences or have connections to communities. And often there are other funds within foundations that they don't publicize. So one is called a discretionary fund that people don't typically know about. So you need to build those relationships and ask if they have a discretionary fund. They often go up to $25,000 to $50,000. And what's happening now is that a lot of foundations are looking for you to partner. So even if it is, you can do everything that the grant is requiring, they want partnership because they want greater impact in communities, and get a bigger bang for their reinvestment. And so that's what I would say, is to really just share this opportunity. And we need help in terms of COVID testing, so please share it, with other people. And, feel free to call us if you have questions about either one of these grants. And for HBCUs, the Rapid Research Pilot Grant, this is a great opportunity to get $200,000 to work on look at the feasibility of testing technologies within our communities.
Thank you, Marilyn. Nicole, what are you thinking?
Well, first, this has been an awesome conversation. I think if I was going to say any kind of like closing words, it would really to be encouraging to folks. My experience here in just a matter of 6 months has been something I would have never expected. I truly want to encourage people that there's so much people power around you. Your network is so amazing. I might have been the brain to help this happen, but the truth is, without the network, without the people surrounding and supporting this work, I couldn't have even accomplished applying for this grant and now having it. So I really want to encourage people to realize that you can accomplish so much more than you might think, and that it's stepping past that moment of fear is all you have to do. You never know what's on the other side of that. So this is a really, really unique time in terms of money, truthfully, in terms of being Black. Let's just be real. There's so much conversation right now of funding specifically to help initiatives that are around disparities, around inequality. This is the opportunity, I believe, that we've been long waiting for. And I'm like, let's take advantage of the money that's flowing right now and put it to great use to see some amazing changes happen in our communities.
Thank you, Nicole. Thank you, Marilyn. Thank you, Aaron, for joining us this afternoon. I want to encourage you to stay connected with Community Campus Partnerships for Health. Again, I mentioned this is the third in a webinar series that we're doing at the heart of the matter. And we're excited to announce that we'll have our next session on September 28th. And it's entitled, Are You Listening? HBCUs Respond to COVID-19. We're so excited to have faculty, staff, and students from North Carolina Central University, Clark Atlanta University, Stillman College, and Alabama State University joining us. Tell your friends, tell others about this amazing webinar series. During this part one series next week on September 28th, please register for it. This is part one. We will focus on what HBCUs are doing in response to COVID-19. We'll place in the chat box a survey that we would ask that you would take to provide us with feedback and to help us in prioritizing the health issues within our communities. We also have another webinar next Wednesday, Improving African Immigrant Health Series. CCPH has been very involved in webinars, and we've been using the virtual space. So next week, we join Chiome Naji, one of our CCPH board members, in facilitating a webinar entitled, again, Improving African Immigrant Health Series, a photo voice examining the impact of COVID-19 on African immigrants living in the New England region of the US. So all of these are opportunities for you to stay connected to CCPH, to join us. We've placed in the on the screen here, stay connected through our website at ccphealth.org at the heart of the matter. The archived copies of the webinar are there. Charlene says, this was excellent. Thank you, Charlene. Share this with your friends, share it with your neighbors, share it with your colleagues. We're building a network. We hope that you will join us for future sessions of At the Heart of the Matter. This is Al Richmond, Executive Director of Community Campus Partnerships for Health, saying thank you for joining us today, and thank you to all of our speakers.